we want to make sure we get this for anyone who can't be here with us this morning and like to see it later. All right, very good. Well, I think we'll go ahead and get started. Good morning, everyone, and thank you for joining us. We really appreciate you being here, I guess, from your homes, it seems. Tax day that is not tax day. So here's our agenda. It's changed a little bit this morning from what we sent out. We've moved the order around just a little bit and put more of a focus on really talking with y'all about how you're coping, how your practice and organization is getting through this difficult time. We'd really like to figure out what resources you're utilizing, what workarounds you're doing, and how you're supporting families with children with special health care needs. So I heard something on a news program the other day that was kind of an eye-opener. They were talking about kind of the 5 stages of the pandemic, and the last one is preparation, because this won't be our last. And I thought, wow, I think I sort of understood that, but until I heard this particular program, it hadn't gotten into my brain that this could very well and will almost certainly happen again. So we need to keep that in mind, and anything that we're figuring out now that works can be reused and honed, and that's what we want to really focus on today. But we're also excited to have Tania Tetz with us, who will be talking with us about a program that she is working on at the Department of Health called Becoming Askable Adults. So she'll be actually right toward the top, and then I know that Dora and Jill from Shriners would like a few minutes to talk about how Shriners is working through this time, and so that'll be kind of perfect with our meeting. So I want to make sure to ask people to turn off their microphone if they are not talking. Got a little background noise. I do apparently have the ability to mute everybody, but I'd kind of rather not do that and let you do that yourselves if you don't mind. But if I do that, just know I might do that. Okay. So as I mentioned, we're mixing things up just a little bit, and that's because we weren't quite ready with some of the list features that we would really love to show you when they're very robust. But also just because I think this is a great opportunity to really meet up, come together. We didn't meet in March. I've missed you all. This is a time to really talk and share and let us know how you're all doing. That's what we want to know. So we'll start off with our.
Lily, are we recording?
Mm-hmm. Yes.
Okay.
Yeah. Yes, we are. So we'll start off with our usual welcome and introductions. And so I think that most of you will know me. I'm Mindy Tueller, and I manage the Medical Home Portal, and I facilitate the Utah Children's Care Coordination Network. These meetings that we usually have at the Salt Lake USU site in Taylorsville, but at least for the next couple of months, we'll be doing these all online. And let's go ahead and go around the room, and I can see you. So what I'll do is just go ahead and mention your name and ask you to unmute and tell us who you are and the organization you're with. So Chuck, do you want to go next?
Sure. It's Chuck Norland. I'm the director of the Medical Home Portal, and glad to have all of you here and safe and healthy, and looking forward to learning how you're coping with this new thing we've got.
And Erin?
Hi, I'm Gina Shoemaker. I'm the administrative assistant for the Medical Home Portal. And honestly, I'm just glad that we all still have jobs and are working. So I'm grateful for that.
You're here. All right, Gina.
Hi, I'm Gina Bolameni. I am currently the Associate Director of the Utah Parent Center and the Director of Utah Family Voices.
Excellent. All right. Linda.
Hi, I'm Linda Stevenson with Integrated Services in Richfield, and we also have Dana Anderson with us from Richfield too.
Sorry about that. Great. Welcome. Thank you. All right, Linnea.
I'm Linnea Bauer. I'm the Portal Services Support Manager for the Medical Home Portal. I work with our partners and then with some design stuff and whatever else that they need me to do.
Great. Cynthia?
Hi, I'm Cynthia, and I'm a psychologist with the Integrated Services Program.
Fantastic. Thanks for joining us. Jill? Jill, you're muted. Time out, she says. Okay, Jill's with Shriners, and hopefully we'll have her talking with us in just a little bit here. Great. Oh, Natalie.
Hi, I'm Natalie Allen, and I'm a nurse practitioner for the Utah Department of Health Children with Special Healthcare Needs.
Great, thanks for joining us. And I see next someone, caller 2. So I think we've got a couple of people who are just coming in, at least for audio, by phone. So I'm not sure if you're able to see that you're caller 2 and you can tell us who you are.
This is Liliana from Southwest Children's Clinic, and I'm the manager.
Okay, great, Liliana. I see that you're both on the computer and also calling in, so that will sync that up. Great, thanks.
I'm on a dock station, so I'm just gonna mute this one because it sounds really bad.
Thanks.
Okay.
All right, and I see someone with the information SPP28. I'm not sure if you can see that on your end, but we'd love to know who you are.
Can you hear me? Kathy Crane. I'm a care coordinator at Bauer Pediatrics.
I didn't quite catch that. Do you mind trying that again?
Yeah, can you hear me?
Yes.
This is Kathy Crane. I'm the care coordinator at Bauer Pediatrics.
Hi, Cassie. How are you? Great. Okay.
Good.
All right, Gabi.
Hi, Mindy. This is Jill. Sorry, my computer screen kind of froze for a minute.
Yeah, Jill, we're still getting some feedback.
But I'm Jill.
Yeah, I'm not sure your audio isn't quite syncing up, Jill. Sorry about that. Might suggest that you try calling in. Don't leave your computer connection, but undo the computer audio option and try calling in the number. There should be an option. I think in the invite. Okay, great. Okay, Gabi.
Hey, I'm Gabi. I'm one of the quality improvement coaches at UPIC. And excuse me. And then also we already had in the chat from Gwen from Price. I cover Carbon, Emory, and Grant counties. I work for ERIC and Integrated Services and CSHCN.
Okay, fantastic. Athena.
Hi there, Athena Parker. I work for the Medical Home Portal and maintain the Utah Services Provider Directory.
Welcome. And Brooke.
My name's Brooke Baystar. I'm a nurse care manager that works out at the Sugar House Clinic.
Fantastic. Welcome, welcome. Dora.
Thanks.
Hello, can you hear me? Perfect. My name is Dora. I work at Shriners Hospital for Children in Salt Lake City, and I'm their professional relations coordinator. And Jill is the director of business development. We work together. So thanks for having us.
Wonderful. Let's go to Kelsey.
Oh no, sorry. I'm Kelsey. I'm care coordinator for
San Juan Integrated Services Program under Eric's team.
Welcome. All right, Tanya.
I am Tania Tetz. I work for the Utah Department of Health, and I'll be presenting today. And I know Eric and I know Cynthia, and probably seen the rest of his staff on and off when we're in the building.
Back in the day.
Back in the day.
All right, George.
Hi, I'm George with CSHCN, Care Coordinator, Tri-County Health Department. So cover Uena County, Duchesne County, and Daggett County.
We're very glad to have you. Thanks for joining us.
Thanks.
All right, Katrina.
Hi, this is Katrina Jensen, and I'm a project manager with Intermountain Healthcare, Children's Health, and joined this group a few months ago, basically focusing on transition of young adults to adult care. And this weather is making me depressed. I just need to say something kind of realistic.
Yeah, I hear you. Welcome, Katrina. Colleen.
Hi, this is Polycrystal. I'm a care manager at the Stanford Health Center with the University of Utah.
We're delighted to have you.
Thank you.
All right, I see a caller 3, so I'm not sure if that's someone who's also joining us by computer, but if you know that you're caller 3, we'd love to have you introduce yourself.
Yes, hi. I don't know if I'm caller 3 or not, but I've been on for a while. I'm new to Utah. I'm a care coordinator. I'm also new to care coordination. My name is Alicia Swartzendruber, and I work at the Utah Pediatrics Clinic. Thank you for having me today.
Yeah, it looks like you're caller 3. I see that box lighting up when you talk. So welcome. We're delighted to have you join us, and we hope that this group can be valuable to you. All right.
Thank you so much.
Walt.
Yes, hi. This is Walt Torres, and I work also with Eric. I'm with the Integrated Services Program, and that is part of the State Health Department.
Welcome, Walt.
Thank you.
All right, I see Gina, but I think that might be, I'm not sure. Do we have a second Gina on the line?
Yes, you do.
All right. Second, same Gina, it sounds like. All right, Noemi.
No, Mindy, this
Hi.
is
Long time no see. I'm representing Willow Creek Pediatrics, care coordinator, and nice to be back.
Hi, Mindy, this is Gina again, and no, there are 2 different Ginas.
Okay, so the other Gina, please go ahead and introduce yourself. Sorry.
No, sorry, that was my fault figuring out the computer. I'm Gina, and I'm from Utah Valley Pediatrics in American Fork. I'm their care coordinator.
Great, wonderful. Glad to have you. All right, then I see someone that is the CSHCN coordinator. So I'm not sure who that might be, but we'd love to have you introduce yourself. All right, I think it doesn't always show up exactly how you've logged in or joined, so we're not sure who that person is, but if we didn't get to you at the end, we'd love to have you jump on and tell us who you are. Angie, do you want to introduce yourself?
It's Gwen. The CSHCN coordinator is Gwen. She's
Gwen,
typing in.
okay, great. Yep. Okay, hi Gwen. Okay, all right, Angie.
Hi, I'm Angie. I am the care manager and behavioral health care director at Alpine Pediatrics Group.
Welcome. All right, and Heidi?
Hi, I'm Heidi. I'm with UPIC. I'm a quality improvement coach.
Hi, Heidi.
Hi.
All right, and then I've got a few more callers, but I think I'll start with the names that I can recognize. So let's go with Gentry.
I manage the team of parent support specialists with Help Me Grow Utah.
Terrific. Thanks for joining us. And Eric.
Assuming there are no other Erics on the line, this is Eric Christensen. I'm the program manager for Integrated Services Program with the Utah Department of Health.
Yeah, that's you. All right, and then I see a caller 5, a caller 7, a caller 8, a caller 9, and a caller 10. And again, sometimes those callers are just someone on the phone who's also on the computer. So if any of you are just calling in, we would love to have you tell us who you are.
My name is Cheryl, and I am the Pediatric Care Manager at North Valley Pediatrics in American Fork.
Great, welcome.
Hi, I'm Janelle Hendrickson.
Go ahead.
Can you hear me?
Yes.
Janelle Hendrickson. I'm calling from the Holiday Pediatrics Nurse Care Manager.
Great, terrific. All right, is there anyone else on the line that we have not heard from? Okay, all right, well, thank you everyone for introducing yourselves. That's terrific, we appreciate it. We've got a big group here today and I'm just delighted. That's fabulous. So let's look at our housekeeping. I usually like to tell you where the bathrooms are, but you know where they are. So as we have told you before, the best experience typically for these meetings through GoToMeeting is on your computer. However, there are other options, so whatever works best for you, but we do like to encourage you, if you have a computer, a laptop, or some kind of device that you can log into, that's typically going to be your best experience. And we will go ahead and try and end promptly at 9:59. Our GoToMeeting account is being heavily used these days, so we want to make sure that if somebody else needs to use it, they can jump on. Okay, so a couple of announcements. As of course you know, we had to cancel our annual learning session, and we feel very badly about that. So we're just kind of watching and waiting to see what's going to happen, and we'll hope to hold that learning session with that topic again when we're able. We also had planned for our May meeting to have a tour and a meeting at Shriners, and for obvious reasons, we won't be doing that in May, but again, we look forward to rescheduling that when appropriate. And speaking of Shriners, Dora and or Jill, if you'd like me to allow you to be the presenter for a minute, I'd be happy to do that, and we can let you guys give your updates.
Sure. Can you hear me, Mindy? This is Jill.
I can.
We'll try this on
want me to make
my end. Yeah.
Okay. Let's see if I can figure out how to do that.
And if
it shouldn't be this hard. Screen share, there we go. And then maybe if I undo that. No.
I just did it. Jill, you should have access. Mindy, I just did it. Jill should have access.
Thank you. Jill, is that looking like it makes sense to you now?
No.
Let's see.
I don't see. I keep on getting, you know, I had feedback earlier on. I keep on getting kind of a whirling circle that I have a lag on my screen. But that's okay, Mindy. And I can kind of just explain to people where to find our information on our website. So what I wanted to share with this group is that Shriners Hospitals for Children in Salt Lake City is still open. We are open to a more limited, prioritized list of patients. As with the rest of the state, our elective surgeries at this time have been canceled, but we are still treating many patients. And of those, so we are accepting new patient referrals at this time. Appointments will be scheduled at the soonest available time with priority given to time-sensitive care. And that includes, but it's not limited to, urgent fracture care, possible bone infections, and surgeries dependent on a specific period of childhood growth. So for example, our clubfoot clinic continues to run quite aggressively. We have, those clubfoot babies that are treated with the serial casting method, and they run through our clinic every week. So we are still continuing to treat those patients. And again, fracture care, that's something that a lot of people forget to think about Shriners for that service line. We don't have an emergency room on site, so as long as the child has been stabilized, we can see those fractures and treat them. So our outpatient clinic continues to run Monday through Friday at this time. And on our website, if you go to shrinerslc.org, on the front page of the site, you will see a COVID-19 message, and there's a link at the top. It says what to expect at Shriners Hospitals for Children, Salt Lake City. If you click on that link, it has all of our new patient referral information, including our new patient referral line, and it also has a link to our virtual visits. So we are seeing quite a bit of patients virtually at this time too through our Skype technology. And that seems to be working quite well in seeing a lot of these patients who are currently in our system. And I can send you the link to our website, Mindy, so you can forward that to the group.
That would be great. I'll be sure to do that. Okay, well, that's good to know.
Does anyone have any questions?
And if you want to type your questions in the chat box, that's also fine, if that's easier. Okay, well, it sounds like no questions at this time, but you're very welcome to send those to me, or I'm sure we can have Dora and Jill's contact information go out. So if you have any questions, you can reach out directly to them. Thank you for that update. It is good to know that Shriners is still around and able to help. That's great. Okay, just a couple of quick updates, and then we'll turn the time over to Tanya. So we have some updated clinical content that we wanted to make you aware of. We have recently updated our Tourette and the LCAD diagnosis modules, and also our screening pages on toxic stress and hearing. And we've also updated the following pages in our For Families, section. Information about after high school, complementary and alternative medicine, and FAQ pages for parents on anxiety and POTS. Okay, so now we're going to switch it over to Tanya, and maybe I'll ask you to go ahead and do your magic again, Linnea. And Tanya, you should be able to be the presenter shortly, and you can share your screen.
I'm waiting.
Maybe.
Maybe.
And if you need me to, I've got your presentation, so I can always show it.
Yeah. Yes, I'm still not the. Okay, this one. Let me know if can you guys see it?
Yes. Yes.
You can? Okay. So we're gonna go ahead and start from the beginning. So, okay, my name, like I said before, my name is Tania Tetz, and I work for the Utah Department of Health. I've been there for 12 years, and I work in the Family and Youth Outreach Program. And it's a new program. We've been probably together for about a year, a little bit over a year. And my role is to work with adolescent health. So I'm gonna go ahead and talk about becoming Askable Adults, which is my project. And let me see how this goes. Okay, so as you know, here's the vision and the mission and vision of the Department of Health, of which we are part, and we just want everybody to be healthy. That's the bottom line. Let's see. So during this presentation, I'm going to cover what is an Askable Adult, why Askable Adults matter, give you some project information, and also show you what we're using and how we're going about things that you can share with your clients, or if you're interested, you can even use it. So what is an Askable adult? An Askable adult is any adult that a youth or an adolescent, and when we say adolescent, we're talking about somebody between the ages of 10, 11 until 19, you know, that the youth trusts. This is an adult that they trust. This is an adult that is also approachable, or the youth considers them approachable. And this is an adult that makes a space that is safe and open to any questions. And I cannot emphasize any enough. You know, any question is fair game. And also, these people are a source of information and or values. You know, they look up to these people. So this is what an Askable adult is. So why do the Askable adults matter? The Askable adults have been chosen to be a protective factor. A trusted adult is a protective factor against adolescents engaging in risky behaviors. They are also needed by all the youth. You know, doesn't matter who they are, they need to have somebody that they trust to come and talk to their situations, ask questions, and anything that they need to learn about. When it comes to youth with disabilities, this is very, very important because the youth with disabilities are considered a vulnerable population. They have the challenge of providing appropriate support to the youth with disabilities may be one factor that contributes to these youth having an increased likelihood to engage in a risky behavior. Also, the research shows that youth with disabilities are more likely than their peers to use substances such as cigarettes, illicit drugs, or alcohol. They are also more likely than their peers to be involved in pregnancy experience an STI, and have sex at an early age. And they need support at much higher level in order for them to thrive as healthy adolescents. So as we can see, an Askable adult is very, very important in the life of any youth. So who can be an Askable adult? An Askable could be a parents and guardians. It could be school personnel. It could be healthcare providers, or any adult, a grandparent, an aunt, an older cousin, adult cousin, so on and so forth. So pretty much any adult that has contact with youth could become an Askable adult. So what is the project that we have here at the Utah Department of Health? In June of 2019, we received a 3-year grant from Utah State University Center for Persons with Disabilities. And as we looked around what we could do, we decided to create a toolkit or some type of training with the purpose to provide a menu of ideas or skills to improve communication between adults who live or work with adolescents that have IEPs, or the individualized education plans. We were aiming for the paraprofessionals because a lot of them work directly with these youth and with the parents. But because of unforeseen circumstances, we are expanding the reach to any adult that works or lives with adolescents that have IEPs or special needs. For example, foster care parents, right? We're going to start working with them so we can train the parents at least on the foster care parents how to communicate better. Let's see what else. So how are we doing this training? There are 3 components that we have. The first one is the Social Emotional Learning and Practice Toolkit by the University of Minnesota Extension. They are known nationwide about how they can do social emotional learning with youth. They're very well known for that. And And in the fall of last year, we carried out a webinar with a variety of the paraprofessionals. And this toolkit actually has different activities that either a teacher or a paraprofessional can include in their daily teaching to help the youth develop social emotional learning skills. And a lot of the times the teachers or the paraprofessionals are already doing this and they just don't know that they're doing it. So we're helping them through this training. The second component that will start next fiscal year is the Sparks training. And this is out of the University of Michigan, the School of Medicine. And these are videos that can actually not only just apply to the school setting, but they can also apply to the healthcare setting. And they include information on how to improve communication and engage with youth when they visit, for example, a clinic or they're in the classroom, or also how to make it more youth-friendly environment in those places so that the youth can feel that the environment is supportive of them asking questions and of them being able to approach the person or people that work there. And the third component is the Teen Speak. This was developed by a nurse practitioner that worked with youth a lot, and this one is focused on parents and caregivers. And this one is a total of 8 hours. You have 4 pre-work hours that the parents can do an hour at a time, and then you meet either for 4 1-hour in-person trainings and discussion with the rest of the group, or you can do 2 2-hour trainings. And this one is the in-person is the valuable part of the training because that's where we learn from each other. And these are strategies. You know, this is not telling the parent, how to do it, but it's just strategies to improve communication. It's a menu of strategies, and they can figure out what works and what doesn't work in their home. And all of these still give room for the youth to get those values that are important, for example, to parents, right? So this is just to improve the communication. We had thought about doing all these in person, but there were some struggles that came along the way. And now with COVID-19, of course, that's not going to let us do in person for a while. So what are we going to do? We are almost done creating our website. And this is the final mock. There's still work to be done on this website, but hopefully it will be done by the end of June. And this is where the parents or the teachers or the paraprofessionals are going to be able to either register to do an online version, including on virtual communication or virtual discussion for the Teen Speak. And then for the social emotional learning in practice part, we worked with the University of Minnesota for them to develop some training videos regarding the toolkit that the teachers or the paraprofessionals can access on their time and learn how to use the toolkit and how to implement the activities, and that way they can still learn and implement those in their classrooms. And with the Teen Speak, we'll have hopefully a group of parents soon who are looking for partners that have access to parents with this population that we can reach out to, and we can carry out these trainings. And especially right now that everybody seems to be pretty much under the same roof 24/7, this would probably be important in how to find or try new strategies to communicate better at home. And then, so that's coming. Once it's final, I can send out the website so you guys can go see it. And that is the project in a nutshell. And here is my contact information. So does anybody have any questions?
Tanya, this is Mindy.
Mindy.
Boy, this sounds really exciting because it sounded to me from your description a lot like motivational interviewing, which is what we talk about on a regular basis in this group. And a lot of people have expressed a desire for more information and training on that. And it sounds like this kind of is what that's all about.
Yeah, it does include a lot of motivational interviewing. That's true.
This sounds great. Well, I have adolescents in my house, so my ears were pricking up because I'm a parent, and this sounds super helpful. Did I hear you say that as you're moving forward with the website and some of the, moving of this to a more online environment, that you would be looking for organizations that have work with parents of adolescents?
Yes. Yeah. We have back in December, we brought the developer of that TeamSpeak materials. I blanked out there for a minute. We brought her in and we trained about 17 people throughout the state that they can implement that program. But right now, there is a cost, but we would flip the bill for it. We would pay for the parents to get the books, to participate, and do all the trainings I have to do. And we're looking for people. Like I said, our program is very young, so we're trying to make those connections. And so if you guys know of anybody, just send me an email so I can reach out to them and we can organize these classes so we can get going with them.
I think there would definitely be the possibility for us to help, make some connections there. So I will stay in touch with you, and I'm the best way probably to communicate with this group. And of course, these folks definitely have families they're working with who have adolescents. So this sounds great.
Yeah, and like I said, the definition of adolescence is between 10 to 19, 10 to 18, the tween period through adolescence. And so anybody pretty much, I got permission to open it up to any parent. So that has, especially we would like to, we're not going to discriminate people by saying, oh, you don't have a child with special needs or you don't have a child with an IEP, but we would prefer, that would be our priority because of where the funding is coming from.
Yeah.
But, if you have a family that they have one child with an IEP and 3 that don't have an IEP, that family is welcome to participate. So, because it helps everybody.
Oh, definitely, right? Okay.
Yeah.
Well, that's great. Anybody else have questions?
There's a question in the chat.
Okay,
says,
let me stop sharing the thing.
Oh, I can read it to you if you want.
Okay, yeah, because I don't see the chat at all.
Can you review what the requirements to participate in this group would be? Can parents join in at any time during the group?
Well, with the I'm going to come up once the website is ready and I have like a good group of people that want to participate. We're going to do schedule like trainings, because the way the training is set up, it's kind of like a cohort type of thing. So if somebody cannot make it during the first cohort, then they can join the second cohort. Does that make sense? Because it builds on each other. The training builds on each other. That's why it's like for 1 hour after and for 1 hour before. There's some pre-work that has to be done, and then we do the in-person, and we have the discussions and talking and stuff. So.
Oh, that sounds great. All right. Anybody else? Okay. Tanya, thank you so much. This is great.
Oh, you're welcome. Thank you for letting me do this.
No, I think this is super helpful, and I'm sure that we would all like to be askable adults, in our various roles. So I look forward to seeing more of the program material.
Yeah, I do have a question.
Go ahead.
Tanya, do you guys ever consider, so most of the training is going to be online. Do you guys ever consider coming out to like a pediatric office and doing training, or is it mostly set up just to do online training?
No, right. It's set up to do in person also. That was the original, but because of pretty much just being me in the state running this, I cannot make it everywhere. You know, that's one thing. And then with COVID-19, who knows how long this is going to last. So we worked with a developer and we're creating it so that we can actually teach it online.
Okay, so once kind of COVID has come down, maybe in the summer, do you think we could, I guess I can email you, but maybe set up an appointment where our staff and maybe some of the parents, we have lots of parents with children with IEPs, could have a training session? Is that something that you would consider once things have kind of calmed down around here?
Yeah, we could totally do that and we can schedule it. And like I said, once we have our website, that's where we're gonna have, we would have to coordinate and do all that stuff, but yeah, that can be done. And so everybody we can set up a registration, I can order the books, I can get all that done, so yeah.
Okay, great, thank you.
And Gina, Money, I am thinking about Utah Parent Center trainings too. I don't want to be presumptive, but boy, this sure seems like something that would be valuable.
And actually, Jody got trained. Jody got trained when the trainer came, training of educators or whatever. Jody went, so I met Jody. She's great.
Yeah. So, and Jody's been trying to implement some of the pieces as she's moving forward with the Utah Parent Center's transition university. We felt like she would be the best one to send to that training.
Yeah. Well, yeah, we can work together.
Excellent. I should have known. Already covered. Fantastic. Okay. Well, I will go ahead and take the screen back. And thank you again, Tanya. We really appreciate it. And I know that Tanya is going to stick around for the rest of the meeting. So if you do have more questions, in theory, you could ask her before the meeting is over.
Yeah.
Great.
One more question that came in on the chat. Do you know when you're anticipating that the website will be complete?
It has to be done by June. I told my guy is like, it has to be done by June if you want to get paid. So yeah.
Okay. Great.
So now I can see you guys. I could not see you at all when I was presenting and I was like, what am I doing? So anyway.
Yeah, I think we all need to have a test session with GoToMeeting and really test out all of the elements of it to feel comfortable before we're presenting with it. I'm still not quite there, but.
So I apologize if you guys could see me and I made a bunch of faces because I could not see anybody. So sorry.
It's a problem with when you do a PowerPoint presentation, it takes over your whole screen. So there's no easy way around that. There actually is a way if you just, well, it would take a while to explain, but you can show it from the PowerPoint as it looks like on Mindy's screen now. But maximize the view. But we'll write out some instructions so we can all share that.
That's a good idea. All right.
Thank you for having me.
Thanks, Tanya. All right. So we are going to do a special edition of our brainstorming section of the meeting where we really just want to let you guys talk with us about how you are responding to COVID-19. And this is personally and professionally. We'd love to hear about resources you've identified. And at some point, I'll ask Linnea to talk a little bit about the page we've put up on the Medical Home Portal that contains COVID-19 resources. But we really want to hear about how, your organization or practice is trying to address certain things. We heard that Shriners is kind of tightening things up, but also doing virtual visits. We'd like to hear a little bit of those kinds of things from anyone who's willing to share those. What you're hearing from families that you're serving about how they're getting through it, what you're trying to help them with, and anything that you've come up with. Again, these are things to help one another now, and then also to be, prepared for if this happens again in the future. So this time is yours, and you don't have to feel like you need to be on camera to talk, but we'll just open it up and I'll be taking notes. And, you know, we also could have Linnea go ahead and start, and that might give you some time to be thinking about what you could share. Linnea, if you don't mind, do you want to pull up that web page and take over the screen?
Yep, just give me a second.
Okay.
Okay, so this is just a little bit of sort of how quickly things moved in with everything. And I was on the phone with our partners in New Mexico, and they said, "Are you going to do anything about COVID-19 on the portal?" And this was on a Thursday. And I was like, "I don't know. We don't normally do sort of breaking news type of stuff." And then by Monday morning, I reached out to Mindy and Chuck and I said, so I think we should. So we spent a lot of time putting this together, and we have a version of this page for every one of our partners, and it does show up right here in the banner at the top of, for those who are seeing my screen, and for those who are just on the phone, just go to the medical home portal and you'll see it. It says information about COVID-19 right across the top of the portal. If you dismiss it, you can make it go away, but otherwise it will show up, and we are adding to it as sort of information becomes available, comes to our attention. We have a version for every one of our partners. So for those like Shriners who might be working with some folks in other partner states, Montana, Idaho, Nevada, there is a version for those states as well. So if you change your region up here, you'll get that. But this is the Utah version. So we have just sort of our general information, a little bit of an introduction. I'm not sure if, how many people really need that at this point. And then the services directory, just a reminder that the services directory information is not necessarily up to date for, you know, what that might be offering at this time. And then general links about COVID-19, WHO, CDC, and then for Utah specifically. So the Coronavirus Task Force, 2-in-1's COVID-19 resources, and then the Utah Insurance Department information about what insurance is doing for COVID-19, and then information for pediatric care providers from Intermountain and the University of Utah Pediatric, because that information is being presented in conjunction. And then we have resources for families and caregivers, and that is just kind of general information from Family Voices, Healthy Children from the AAP, a couple of their specific pages, COVID-19 in the American Workplace from the Department of Labor, to go over sort of what the latest guidelines are on temporary paid leave and that kind of stuff. And then we've got some resources that we're putting together for caregivers of children with disabilities. Then we've just got some sort of like staying connected and occupied, entertainment options, different technology, and then finishing up resources for providers. So some of the educational resources, provider resources that we know are out there. And anything else that you come across that you think is really important, or that your providers are finding helpful, or that you're finding helpful, or that your families are finding helpful, feel free to send them. You can send them to Mindy, you can send them directly to me, however is easiest for you. And we're trying to get a balance on these pages between putting like all the possible information out there, which we think would be overwhelming, and then also trying to make sure we have some of those critical resources. So just let us know.
Thanks. That was a great summary, Linnea. And I'd emphasize that the last thing she said, that we've tried to constrain ourselves because, as you may know, there's millions of things going out over the internet, and some of them are add just a little bit to what you find in other resources. We don't want to have a list that goes on forever. So we'd really appreciate hearing from you with regard to, one, other things that you find particularly useful, but also whether you think it would be valuable for us to add more things to this that come through. And then we are always welcome to hearing feedback about, well, there's really too much on there, or this one isn't really as good as you thought it might be. So thanks again.
Yeah, Absolutely.
Unmute. Okay. So yeah, I guess I'm curious to know what are you guys doing? How's it going? Are you seeing patients? Are you completely working from home? Love to hear about what's happening with you guys individually and how you're trying to work during this time.
This is Natalie, and I want to just make a couple of comments. So we have started trying to use some telehealth options, and I think we spend a lot of time talking about how do we help families during this really difficult time. And I think what it's come down to is that it's not as hard as we think it is. Families just really want to know that we're here and that there's somebody there to help them with something simple like, did you think about trying a timer? You know, like a lot of things are not that hard. And I think we're scared and worried about how we'll help families, and really they just want support. And I have found that it hasn't been that hard. We haven't done a lot of telehealth visits. I've done contacting parents just even by phones in the evening, and I'm finding it to be very successful. And I'm completely working from home, but yeah, I feel like I'm making connections with families and able to make a difference. So I just encourage people to not be afraid. Like families just want to hear that someone's out there worrying about them.
Boy, that's tremendous. It's wonderful to hear that. The one thing I've noticed is that I need to answer my phone, which is ringing a whole lot less, but when it does ring, it's a number I don't know usually, and my instinct would be to let it go to voicemail. But those are people calling me from home, trying to reach out to me for a specific reason. So that's been something I've had to figure out as a parent or a consumer, and that's interesting because Natalie, I assume when you're calling from home, you're calling from your home phone.
Well, actually, the Department of Health has given me a cell phone, but yeah, they have my home phone number. They're calling my home phone number.
Oh, okay. Well, shoot. I guess what I meant to say is it's not coming from a number that looks like a work number, a number that they may have associated with, your office in the past. So yeah, I think that is a side effect. And I think I've seen some things for the University of Utah about phone calls and working from home and home numbers and those kinds of things. So that's definitely a potential downside to this. Anybody else?
Yeah, I had to add my cell phone number to my signature stamp in my email, so people can still get hold of me. And I was in the same boat as you, Mindy. I got phone calls and I didn't recognize the number. And it took me about 3-4 missed calls to find out now I need to answer all of them. And of course, there's still spam in there too. But yeah, I had the same experience.
Well, I wanted to add to your question, Mindy, about how we're doing. So most of the Wasatch Pediatrics clinics just keep going almost business as usual, but things change every day. So things that we have made changes on we changed all our well visits in the mornings so that people, when they call in and when they're sitting in our waiting room, they know that it's mostly, hopefully, all well people that are sitting there, and we try to get our patients back really fast. And then we have sick visits in the afternoon. And our doctors, that's kind of a new thing, started doing car visits. So people call in and they request the car visits. They're too scared to come in. Of course, we can't do well visits that way. There's too much involved with a well visit. But we can do sick visits. So they just pull into the parking lot, and the doctor goes, the nurse and the doc goes out, the provider goes out and does a full visit. The kids sit on the children's lap, the mom's lap, and it's been working pretty well, and the parents seem to be pretty happy with it. It's very kind of unconventional, but it's been working well. And then we moved a lot of our visits to telehealth visits. So we have just in our Willow Creek Pediatric office, we have a psychiatrist fellow, and then 2 full-time mental health care providers, and they've been doing all their visits on telehealth. And we use a platform called ClockTree, and then we also do UpDoc, and that's been working well. And then I just feel like we encourage people to still come in, but of course our well visits have been kind of put off, and people are hesitant. So we have had the drop in number of patients, but with the patients that come in, we try to be really safe and make sure that they feel safe coming into our office.
So Noemi, that's great. So you're in your office right now. Yeah. Okay.
Yeah.
Yeah. All right. And
I mean, it's business as usual here. We just use a lot of masks and good PPE, and we just kind of keep going. All of the Wasatch offices are full business.
Okay.
Thank you.
And are your physicians taking a laptop to the car to document, or do they just do that when they get back in the office?
They actually, what they do is sometimes they start the visit on the phone and kind of take notes and start, but back in their, back in the office, figure out what's going on, what the chief complaint is, get a history, and then go out and do the physical exam and finish their assessment and questions there. But they take out like a little kind of a portable little box that they with all their things that they might need out there, and they're in full PPE, and yeah, we just hope for good weather.
Yeah, really. Not like today, huh? And what are you doing about immunizations, or especially for the older kids who aren't going to fit in the car so well?
So I don't know about immunizations, but usually for like regular immunizations, people come into the office. I don't know if people have I guess they could get immunizations in the car, but I don't know what they've done with that. But people still come in for immunization visits.
And are you staying as busy as you had been, or are people trying to avoid the office, do you think?
It's been quite a bit slower, unfortunately, especially for well visits and kind of in every way. Usually each of our doctors see about 30 plus patients, and I think we're down to maybe about half is kind of my guess. So our office usually is open until 6, 7 at night from 8 in the morning, and we've been closing at 3 or 4 in the afternoon and working with a lot less providers each day as well. So yes, it's been, I think all of our Wasatch offices have been working with less patients due to the well visits, especially being canceled and pushed away by patients.
Right. And have you been doing COVID testing?
No, but I think that's upcoming in our office. I don't know when that's coming, but we do have a machine that will be getting an addition to be able to do COVID testing. So we're kind of eagerly waiting for that. I think the prediction was in the next month or so we'll be able to get that.
Wow.
This is Gina, and I have a question. You might have mentioned it early on, but are you restricting who can come to the office? I know that we just had a baby born within our family, and for the checkup, it was just dad that could go. So are you also implementing those type of procedures that just one parent comes?
Hold on 1 second.
So Intermountain, they have, because I have talked to several Intermountain pediatric offices in the past couple of days, So they dedicated the mornings to well child visits from 0 to 5, and in the afternoon they see sick children.
So it's the same at our office as well, only well visits in the morning, and starting at like 1:30, 2 o'clock, we do sick visits. But people that have COVID symptoms are not asked not to come in, and there's a pretty good triage system as we schedule appointments, and right before they come in, they're asked certain questions if they've been in contact with anyone with positive test, if they have any of the symptoms. Every single patient and the person that they come with gets asked those questions, and we ask to limit extra people in the office, like extra siblings or anyone that can stay home, to stay home.
Got quite a few people giving some feedback through the chat. So Angie from Alpine Pediatrics said, Alpine Pediatrics has dedicated our Orem office to sick visits. That has helped us optimize PPE and manage patient, parent, and staff exposure risk. Our other 4 locations are able to maintain well visit schedules. Our MAs bring patients from cars directly to the exam room to avoid wait room exposure. Check-in is done by phone. We're offering telehealth for some medical visits and any behavioral health sessions as requested. And then Liliana said we're doing curbside telemedicine. Our volumes have decreased 50%. I think Southwest Children's Clinic, our parents really do not want to come in. And then Katie said at the University Pediatric Clinic is doing in-person well child checks up to age 2 and then sick visits, and all other patients are being seen via telehealth.
Okay, so it sounds like every practice is trying to do some things a little differently, respond and also push off appointments that can be done later. And of course, parents are contributing to that by probably canceling those appointments anyway. Interesting. Okay, well, I thought that what Natalie mentioned earlier was really helpful too. Are you guys, when you are doing telehealth visits or in-person visits, are you feeling the anxiety from these families, and are you able to provide them some support and some tools? Are you using motivational interviewing when you're working with them? What are you experiencing?
I do feel like initially when the parents contact us, it sometimes feels like a crisis because it is in their world. But oftentimes it just takes some careful listening and trying to pinpoint maybe a particular issue that we could address a little bite at a time, and reassuring parents that they are doing a good job seems to be helping. Not to say that there aren't parents who maybe are in complete crisis, because I'm sure that that's true too. We've had families who feel like they've lost their IEP services, so they're no longer getting their OT, and in some of our rural areas it's not available. So there are definitely concerns for families, but we're doing our best to support them and encouraging them that, you know, they're capable of doing all of this. I think they're just very tired. And I think the one thing that I'm going to take away from all of this is that I hope the passion that I have about children with special health care needs and rural care is that I hope that this expansion of telehealth is here to stay. It improves services to our families that don't have the ability to get anywhere. And if anything good can come from this, I'm hoping that this stays.
Oh boy, I hear you. That has been really tremendous to see how quickly it has expanded and ramped up. And really that could bust through all of those barriers, you know, if there isn't a clamping down again afterward. And I don't know, Chuck, do you have any thoughts on that from your perspective?
I'm not sure what the question is.
Do you think that the expanded use of telehealth will continue after the threat of COVID has, you know, really, truly gone away, or what do you think will happen at that point?
Sorry, I missed that part of the thread. It's going to be fascinating to see. I mean, as was mentioned, you know, we've been trying to get telehealth expanded for years, but there's been all sorts of resistance from a variety of angles. You know, physicians are resistant, institutions are resistant, payers are resistant. But I think that with this sudden advance, we'll learn a lot, and hopefully it will mean that we'll figure out, well, what visits can be optimally provided by telehealth and which visits can't. Of course, that learning will be ongoing, and technology may provide more tools to be used through telehealth that will enable, you know, one, privacy, reliability of the platforms, because, you know, lots of folks have been having problems with the platforms failing or bandwidth not being sufficient. But you know, I think that at least from conversations I've heard at the university, which has traditionally been quite resistant to the concept, they're recognizing the value to patients as well as to providers. So yeah, I'm optimistic that we will see an expansion of it, and hopefully we'll have some leadership at both state and national levels to facilitate that.
So this isn't specific to Utah, this is Linnea, but when I've been talking to our partners in other states, and then also my mother, who's a mental health care provider in New England, I've been really interested to hear some of the services that haven't previously had any telehealth options that have been able to convert to telehealth, like some of the ABA therapy and other things like that. And I mean, I don't think that that's ideal, but I'm interested to see whether some of the changes in platforms and the providers getting used to offering through those may expand the offerings to some of those rural communities that Natalie was mentioning, where there may never be providers for in-person, or there may never be providers for in-person at the frequency that would be ideal, to see whether some of these can be combined in the longer term.
And I think that's going to be a very interesting kind of line, if you will, of where do the downsides, like distance needed to travel, you know, kind of meet the values, you know, gained from in person, particularly for ABA therapy. I mean, I've never been there during a session, but that sounds like there's a lot of kind of direct interaction that seems to provide some of the value associated with that. But I don't know if it can't, you know, if you have to drive 3 hours to get it, then maybe that's not worth it. So I think that's one of the things that will be worked out for years, is, okay, well, where's the right line? It's probably going to be different by community, different by kind of service, et cetera. But I think we will be learning a lot about that. And I think it'll be fascinating to see how insurance providers address this. You know, they're always worried about fraud and abuse, you know, because this is a little bit less easy to monitor. But yeah, I think the value is substantial. So hopefully they'll be cooperative.
Yeah, that's not really my forte, but hasn't that been one of the things that just really quickly had to be approved, is that telehealth visits could be paid in this time?
Right. Yeah, and Medicare was pretty quick. I mean, I think it was last week or the week before that they officially made a big change in terms of how they would cover it, and then many insurers follow Medicare in terms of how they approach it. So I honestly don't have a good feel for how all the commercial payers are addressing that. Anybody in the group know how commercial payers are approaching this and how your practices are working with them?
Yeah, it sounds like maybe these guys, that's not kind of where their time is.
Sorry, this is Eric. I can't.
I'll chime in then. We've been approved for telehealth visits for the time being. So commercial insurances are paying for telehealth visits through this crisis. So a lot of our doctors, even though they were hesitant at first to do telehealth visits, in fact, they were really against it prior to this incident, are doing telehealth visits when they can, and triaging people that way, and insurances, private insurances are paying for it.
And are they paying at the usual rate, do you know?
I don't know.
Okay.
I don't know the payment for that.
So I think one of the other issues is, and you mentioned triage, that's perhaps a great way to use telehealth, throughout the year, any time. But then what happens to, co-payment requirements and, kind of payment rates? And then what happens if you say, okay, well now, it looks like you are one of those patients we need to bring in. But I think those are a lot of the kind of practical issues that'll need to be worked out over time.
Eric, do you want to say what you were going to say?
Well, it's nowhere near as useful as the information that our last person provided, but I was just going to say that I've been listening to a lot of webinars, with this need to really understand how telehealth impacts families, how it impacts how we provide services. I've been on a lot of webinars. Quite frequently, they're generically kind of Medicare based for like older populations. But as Medicare does, quite frequently Medicaid follows. And it sounds like they're trying, at least for the time being, to really not jeopardize the amounts of money that are paid off of standard claims based upon CPT codes. And obviously the CPT codes have telehealth modifiers on them, but they are relaxing some of the requirements like place of service. Generally, telehealth, you had to meet certain requirements. Historically, it was things like you had to be so many miles away from the nearest health center, things like that. So they're relaxing a lot of those requirements. And my sense was that they weren't necessarily being punitive about the reimbursement rate. And I can't speak to that with sure knowledge, but that's what it sounded like. There was some pretty good will there to make it equitable.
Okay, interesting. And Liliana from Southwest Children's Clinic is saying that she's been told that their telehealth visits would be paid at the contracted rate as long as they're using that modifier that you were mentioning. So, okay, well, interesting. It's all still a little bit fresh, but maybe we'll know more, next month and in the coming months. So, really interesting. Okay, well, I don't want to forget about, anyone having some wins. So if you've got anything that's happened in the last couple of months that you'd like to share with us, any tough cases that you would like help with, any of those kinds of more traditional things, this is also time for that. We'd love to hear if there's anything that we can do to help you, support you. If you are aware of a new resource, we'd love to hear that.
Well, I just have one thing to add to Chuck asked the question and I just ran and asked. But I guess during COVID time, telehealth visits are refunded, even phone call visits are refunded like the patient walked into the clinic and had a real visit. So that is a great advantage for patients. So it's billed the same way and you just kind of chart it as a telehealth visit, but the payment is equal.
Well, that's great. And I suspect that, both patients and providers will be lobbying insurance companies to continue that once this is over. So that sounds very optimistic. Thank you for sharing that.
Okay, I have a win. It's a personal one, but I think it's relevant. So we have the social network called Nextdoor that I'm on, and a mother posted something, I don't know, a week ago maybe, asking if anyone had an old iPad that her children might be able to use for some of their, I can't remember exactly how she put it, but I interpreted it to be like school stuff. And she said she had 4 kids and they didn't have enough devices and turns out we had a really old iPad that was literally buried and dusty and hadn't been used forever, and I was afraid it was too old, but I booted it up and I wiped it clean, and I put it out on the porch for her to come and get, and she sent me a message like the next day saying that they'd used it successfully for some therapy appointments with the Children's Center. And so I was just delighted because that's what telehealth during this time should be for. And she mentioned something about art assignments that they were doing on it as well. And I'm not sure if those were part of the therapy or if that was actual schoolwork or whatever. But anyway, that was a win that just totally goes along with, you know, how we can employ technology to really help each other and support our patients and our communities.
And I'll share a win on a personal side. We've completed, my wife and I completed a 1,500 piece jigsaw puzzle. Took us 3 weeks, but we completed it.
Well, now you're going to have to find another one, Chuck.
No, we're not going to do that. Plus, I hear they're all sold out. So.
I think I heard that too. So yeah, we'd love to hear what you guys are doing to stay sane. It really might help the rest of us. So if you have anything that's working for you, this is a great time to share it.
Hi, this is Eric again. I just wanted to say I have been incredibly productive, but sometimes it's because I've sat at the computer for 5 or 6 hours straight and haven't gotten up and moved. And I really worry that the blood clot in my leg is going to lodge in my lung at some point. So the important thing here is, I think, for people to get up, walk around, walk outside, take a break every now and again. I was laughing because at the office, you're very social and you get the opportunity to interact with other people and, you know, get up and walk down the hall and do some of that. And while I've appreciated sometimes not as many interruptions of, you know, folks coming in my office or other pieces, it can be detrimental to not get up and move. My eyes are exhausted by the end of the day from staring at a computer screen all day long. So my biggest piece is I'm trying to be smart about getting up and moving. And you know those annoying blips that come up on your smartwatch that say breathe or move or whatever? Now is the time to let the Apple Watch boss you around, and when it tells you to stand up and breathe, follow its advice.
Eric, I second that one, and I got in the habit of setting a timer on my iPhone to get reminded to get up and either go downstairs or move around or get another cup of tea or coffee. Otherwise, I'm in the same boat. I would just sit here for 8-9 hours straight through and then try to get up and every joint is aching.
Here, Mindy, I got this from my boss around noon. I tell my husband and my daughter, come on, let's go. And we go for a walk around the neighborhood. So that's one thing. And then also our boss is doing 2 calls a week with the entire team. Like the first one in the week is to do updates, program updates, you know, what's going on, because we're all working from home. And then on Friday, we do a virtual lunch. So at noon, we just eat, we just log into the computer. We are all eating at our own homes and we're just talking about funny things, you know, not necessarily business. We're just like the plans for the weekend, who's remodeling what, you know, just to kind of get our minds off of whatever's going on. So that's what we've been doing.
Oh, that's great. That's really good.
Anybody? I would just like to shout out to the teachers out there. Having 3 children at home now through till the end of the year, and one of them struggling, not only scholastically but emotionally, has been very draining, to say the least. But so man, these teachers deserve a heck of a lot more than they're getting paid. I know we all know that, but I think now that the kids are home and we as parents, trying to homeschool kids, that I'm like, I have no idea how to do this. I don't remember how to do this. why, having to submit assignments in 3 different applications. And it's, so just shout out to the teachers. Hallelujah that they're there. And I'm looking forward to the day that we can send them back to school.
You're here.
Well, I think that we all need to have plenty of self-compassion right now. So when I've been reading things or my little app pops up a reminder or whatever, it's often about if you were talking with a friend who was struggling, how would you respond to them? Try and bring that back to yourself as well, because we are not going to be perfect during this time. Far from it. And we need to recognize that we're doing our best and that tomorrow's another day. And really just be kind to others, be kind to ourselves, be kind to our children. They're struggling right now too. And we'll get through it. We will. So
I've had some friends, I was just gonna say, I've had some friends recently lose their job already, best friends. So they're going through some times right now. We decided on Friday nights, we joined the app house party. So I just talked with my girlfriends for about an hour and a half on Friday nights. 2 of them lost their full-time jobs out of us 4. So I think it's been really helpful, whether we're doing a facial on the screen or having a cocktail. That's been helpful with my group of friends. Unfortunately, it's hit them pretty hard.
It's Passover right now, so one of my friends. Sorry, it's Passover right now, so one of my friends did a special Passover Shabbat since everyone's stuck in their house. So it was people from across the country from a bunch of different faiths, but just kind of going through those traditions and trying to observe those, those times. And I have a lot of friends who've been doing different seders and stuff. And I guess one of the wins is one of my friends who lives in Germany was able to do a seder with her 93-year-old grandfather in Philadelphia for the first time in years because they were all on Zoom. So that was nice.
I'm going to give a little shout out. Noemi Gay, who has so greatly contributed to our conversations today, finished her DMP project and she is graduating as a family nurse practitioner from the University of Utah. So this is a win for Noemi. She didn't say it, but I'm giving it for her.
Congratulations.
That is fabulous. Good going. That is a lot of work. Congratulations.
Mindy, if I can share something else, this has to do with the youth. Somebody mentioned that their children are emotionally struggling, and they all. I was texting my sister who has a daughter the same age as mine, and I'm like, how did they take the news that they have to be home for the rest of the school year? And she's like, mine got mad and walked off to get like the anger out and stuff, and mine cried. So a lot of the times what's worked for us is to do some small service project, like for their friends. Get a bunch of candy bars and just doorbell ditching. Just go in and drop them off and run for their friends, or even doing Zoom meetings with their friends or FaceTime. That kind of helps them a little bit more to still feel connected, because right now it's really hard for them and tough for everybody. That's an idea to put it out there.
Oh, I think that's great. I keep telling my kids to write down everything they're missing. And sometimes they think that seems weird, but I think it's cathartic a little bit to, make it real and give it space. Everything that you can't do, maybe make a list, and that's one way to sort of cope with it. Katie has put something in the chat. Her audio isn't working. She got a request from a doc. Okay, so this is kind of back to our traditional brainstorming. A kiddo needs a spacer for an inhaler and Medicaid won't cover it. They already tried prior authorization. It's $30 out of pocket. Anyone have any ideas for a lower cost or a free spacer? She's trying to verify with the doc that they're eligible for the home visit program.
I would just have them contact Brittany if they're in Salt Lake County. I would just have them contact Brittany Perry, because I remember Andrea Jensen saying that they can give out spacers. So I would just contact Brittany Perry with the home visiting program and just say, hey, do you have a spacer that we can have? I would not suspect them saying no.
Okay, good question. Good possible answer. Okay, Katie says perfect. Thank you. All right, and that's what I was going to mention a couple minutes ago, is that we have our list, and I'll go ahead and include that list email address in our notes from today and our resources of the month. But that list is for you guys. And so it's not the fancy constant contact kind of formatting. It's just email. And when you send an email to it, it goes to the entire list, and anyone can respond to the entire list. You could also choose to respond just to the person who sent it, but I think the list enjoys seeing those responses that can be very useful. So we don't have to wait for these meetings. If you want to ask for help, have questions like Katie's, or if you come up with something really fantastic that you'd like to share, that list is for you guys. So again, I'll go ahead and make sure that that list address is in our notes so that you can utilize it between now and our May meeting. So, and wow, we're almost out of time. So if there's anything else that anyone wants to say really quickly, you could do it now. Otherwise, I think we're going to go ahead and call it. Again, next month will be.
I think it was a great.
Oh, go ahead.
I think it was a great meeting. I expected more difficulties, technical difficulties, but I think I am very, very pleasantly surprised how well this meeting went.
Gabi,
I agree. Thank you.
I agree. This was great. This was great. Yeah, we look forward to having all of you join us again. We hope that works out. And we'll definitely be in touch. Resources of the month will go out. Information about Tanya's program will go out. Information about Shriners will go out. Our list email address will go out. And yeah, just please stay safe, stay healthy, stay inside. Good luck with the rain today and the snow tomorrow. And we'll see you soon. Thanks, everyone.
Thanks, Mindy.
Bye, y'all.
Bye.
Bye, Jack.
See ya. Bye.